Everyone wants to take their business, their skills, to the next level. Small and mid-sized business owners have exceptional insight into how to do this. They endure and thrive because they find ways to overcome the challenges that come their way, and they can teach us valuable lessons to apply to our own companies and lives. Stephen Nooner, founder and owner of Alkali, a company with a unique process that helps businesses more effectively buy and manage their insurance programs. And Bob Gibbons, builder of Riata Commercial Realty, a real estate advisor and tenant advocate, are two prominent Metroplex businessmen who, along with their weekly guests, will ask their and your probing questions, finding impactful solutions that will help you reach for the next level. Here are your hosts, Stephen Nooner and Bob Gibbons.
Welcome to the Next Level, conversations that propel business. This is your host, Bob Gibbons.
And I'm Stephen Nooner, and I'm excited. I get to introduce my friend and personal physician, Dr. Nelson Simmons. Today we're going to discuss a psychological disorder that is required to work with Bob daily.
He's not a psychiatrist, knucklehead.
Oh, yeah, just kidding. Seriously, though, Nelson is the founder and CEO of Personal MD Family Healthcare, a company that pioneered and innovated a service that actually provides real value to healthcare consumers. I'm excited to talk about this. To learn more, please visit personalmd.net. Welcome, Nelson.
Thanks for having me, guys.
Well, we're excited to learn all things medical today. We're going to ask you all kinds of questions. We're going to want to know how you can heal people. And so we're excited to get into it. But before we do,
I'm ready to share.
All right, good. But before we do, we're going to talk what we call wisdom of others, which is a quote. We're going to use a quote that you gave us. It says, "If you're not growing, you're dying." But you don't know who that was from. Why do you like that quote?
It's dire from a physician.
I know it does sound kind of ominous, doesn't it?
Well, it's a quote that I use almost as a mantra. I don't know who provided it. It's probably old. Probably many people that get credit for it. But to me, it's a mantra that I live by in all aspects of my life, in business, personal, physical. There's just so many places that it can be applied. But the idea is that if you're not progressing, if you're not advancing, if you're not growing as an individual, if you're not growing your company, if you're not trying to keep up with the modern era, if you're not growing a number of clients that I have, then ultimately I start to die financially, spiritually, physically. So I use it in all aspects of my life, trying to keep myself moving forward and pushing forward as much as I can.
One of my mentors early in my career, he had a sort of the flip side of that quote, which was, "There's only one way to coast, and that's downhill."
There you go.
So it's the same kind of idea, just the reverse.
Yeah, and as I listen to other podcasts, I hear so many great quotes, that you guys have shared here on this podcast.
Oh, really? You've listened to us?
I have. I try to listen. As soon as Stephen told me about it, I was like, let me listen. And so, I've been listening, and I hear all these quotes, and I think so many can apply. But this one is personal to me, and I've used it for years, and it's one of the things that's propelled me to keep growing.
I mean, that's the journey of what an entrepreneur is, right? Taking things to higher and higher levels. And if you're on that journey, you're probably not on that journey just in your business, although I guess some of us are. But to me, I wouldn't know how to do anything else than to pursue ahead in all areas of life that I'm committed to.
You bet.
So, Nelson, what made you want to be a doctor?
Oh, that's an easy one. My dad had a heart attack when I was about 12 years old.
Oh.
And it was one of those 2 a.m. type heart attacks. And, we were in the hospital, and we were sitting in the basement of a Methodist hospital in San Antonio. There's this long hall, and a doctor, his name is Dr. Schnitzler. He's a cardiologist, walked out of the double doors down this long hall, and my mom and I were sitting there, and he goes, "Your dad's going to be okay."
Oh, nice.
And I said to myself, I want to do that one day. So I was originally going to be a cardiologist. That was kind of my whole drive, because I wanted to be that doctor. But as I got into it, I didn't exactly love cardiology, so I ended up being a family physician.
And so you're a family physician. How did you, and you were in a practice, I know, so how did you go from that to entrepreneur? And really not just, I'm going to open my own practice, which people do all the time, but you really did something that is still very unique and special, but although becoming more commonly repeated.
Yeah, back in '98, there was a group of doctors up in the the Northeast that had started, Northwest had started a model where it was direct to consumer. They were being hired by individuals to take care of them. They were charging astronomical fees. But there was one guy in particular, his name was Garrison Bliss, that felt he could charge a much lower fee to a lot more people and make it much more affordable. And he pioneered a concept called direct primary care. At the time, it was, there's all kind of names for it: subscription care, or pay for service, or hiring your own doctor, concierge care. But the idea was that you could directly contract with individuals versus contracting with insurance companies that then contracted with individuals. So when I got out of medical school and my training, I joined a group called Family Healthcare Associates. They were based, it's actually a group without walls. They had about 60 physicians that all worked together, but they all had individual offices. And I was able to learn a lot about the medical business side, which is never taught to you in your training. And after 3 years, I was offered a partnership position, and that was kind of my fork in the road, as I had been hearing about what these doctors were doing, where they were contracting directly with individuals. And I looked at my partners that were working down the hall for me, and I just felt like they were going from room to room to room and not really able to develop relationships with their clients in the way that I felt was the fun part of medicine. I ended up deciding to make a big decision to turn down the partnership offer, basically leave that particular practice to open up my own.
Your wife must have thought you were nuts.
Yeah, it was one of those things that, we borrowed a lot of money to get through training in medical school, and here we are with an opportunity to be a partner. And I said, honey, I want to turn it down and borrow a lot more money to start my own practice.
And they're still together.
Yeah, I was going to ask.
So 22 years later.
And how does your second wife feel about this?
So, but it was a leap of faith at the time. I was kind of young and dumb and had these big visions, and I sat down and had a business plan that I had put together off of a website called businessplan or .com or whatever, and I downloaded a simple version. I walked into a banker's office and I showed him my plan, and he says, "Yeah, we'll back you."
Wow.
I had created a website about 2 a.m. I don't know how to make websites, but I still run my own website. But it was all these little baby steps, and God kept pointing green arrows in the right direction. And finally, as I had to make that hard choice to either join the partnership or leave, I ended up deciding to leave with the concept that if it didn't work out, I would just start taking insurance again.
Okay, so let me stop you for a second, and I want to kind of drill down on this a little bit. So in the practice that you'd been in, you were saying that part of what you didn't like was the fact these guys were having to churn through their patients so fast. They didn't really get to spend the time with them that you wanted. And was that because of insurance, that the insurance model sort of forces that? Is that because they're just not charging enough? They're not reimbursing enough, I guess is a better way to say it.
Yeah, the reimbursement rate continues to drop as insurance companies continue to put value on different services. And I had to see roughly 20 patients to break even. And then my profit was above that. So when I started doing the math, you had to see, 30, 40 patients a day in order to make a decent income. My partners were able to do that. They had kind of developed a knack for doing that, but it was quick. And for about 2 weeks, I had put a timer on each one of my doors. As I walked in to each room, I would hit the timer, and as I walked out, I would stop the timer. And it turned out I was spending an average of about 8 minutes in each exam room. And
wow.
I ended up calling that reflex medicine, and I felt it was risky. And the kind of the moment that I made the decision to leave that practice was when I was at Lowe's during my lunch hour, and I ran into a person that I knew, and it turned out that I couldn't remember who they were, but I had seen them earlier that morning as a client.
Oh, no.
And it just was an eye-opener to me that I really wasn't engaging with my client, that I was simply just practicing what I call reflex medicine. So it was the moment that I decided to kind of start my own company, take on a challenge of being able to start this concept that was becoming pretty popular. At the time, I was one of the first 250 doctors to completely eliminate insurance from my practice when I started Personal MD. The hardest part about
nothing you think of the country.
Yeah, the hardest part about doing that was educating the public about what I did.
Yeah.
And back in 2003 when I started it, the majority of people had some form of insurance. It was pretty much an employee, right to have insurance, but that has slowly transitioned, and now there's so many people that don't have coverage, or the coverage that they do have is difficult to manage.
High deductible. Yeah. Yeah. So in your new practice, then, have you done the time study to see how much time you're now spending with them?
Yeah, I know he spends a lot more than 8 minutes with me. I mean, and
well, that's because there's so many things to deal with.
Well, another thing too is before I met Nelson, started seeing him, I would go in and I would ask for the first appointment of the day because, I have lots of commitments, family, whatever, and I would still not get out of the doctor's office sometimes till like 11 o'clock. I don't know what I was waiting for. So I don't know. And I talked to so many people who had that experience. It's refreshing.
When I actually...
And what's the value of that?
I left a doctor once because after going through all the nurses doing their thing with the tests and all, this is actually for glaucoma, doctor, I have glaucoma, and I waited for 2 hours for this guy to walk in the door, and he never walked in the door. And so I finally got up and left and just said to the nurse, have him call me. Never got that call. Yeah.
One time I had a lawyer bill me for the time that he waited in my waiting room.
Wow.
Yeah.
I've thought about it.
And he charged by the minute. So it was a big bill. My current practice, we only schedule one appointment at a time. There's only, I have 15 slots a day. I see roughly 13 to 14 patients on any given business day. So It's a little bit different structure. But the reason that I can do that is because much of my costs are offset by people paying a membership fee.
Okay. So the person walking in the door is the one paying you, not an insurance company.
Correct. And what we do is we set up a contract with either an individual or a small company, and they pay us on a monthly retainer model, and in return they can come in and see us as much as they need to. We don't put any limits. We don't charge for pre-existings. Our concept is that we just want to have a relationship with the patient, and our commitment is to take care of them, and in return, we do that for a small fee.
So do they then turn around and bill their insurance company for those services and get reimbursed if they want to?
Every practice like mine across the country does it a little different. Okay. And that's probably one of the things that has hurt us as a model, is that there's no real uniformity within the way that we practice. These subscription models, these services tend to be difficult to become cohesive systems, and ultimately that's what has kept us from growing as fast as we should.
Well, we're going to go to a break. What is Nelson's biggest pet peeve? Is it that we won't all eat an apple a day? Stick around.
And now, Confessions of a Recovering Landlord.
This is Bob Gibbons with Riata Commercial Realty, and I am your recovering landlord. After 20 years as a landlord, I now use that experience only for the benefit of companies that lease or buy office buildings and warehouses. Today's confession: knowledge is power. We all negotiate from a position of power and strength, or at least we want to. In any negotiation, the party with the most knowledge probably has the upper hand, and landlords count on this being the case whenever you're negotiating a lease, because most landlords are professional real estate investors and they hire professional leasing agents and property managers. Landlords are in the market every day negotiating leases, while tenants probably only negotiate 1, maybe 2 leases every few years. So tenants feel outgunned. Don't let landlords have all the power. As a former landlord for 20 years, I understand how landlords think and what motivates them. So let me put that knowledge and experience to work on your side of the negotiation. To learn more, contact me at TexasTenantRep.com. Again, that's TexasTenantRep.com.
Have you started making plans to take your business to the next level in 2016? Hi, I'm Stephen Nooner, founder and CEO of Alkali. We have a trademark process called the Empowered Advantage that enables CEOs, business owners, and entrepreneurs to more effectively buy and manage their insurance. Before sitting down to make your plans for the new year, here are just a few things to consider. Would you say that you have an actual insurance strategy, one that you can articulate, or have you just purchased a policy here and there over the years? If you have an insurance strategy, was it discussed under the pressure of a renewal deadline or considered earlier in the year to avoid fire drill decision making? If your answer was no to either of these questions, then you may not have the right partner on your team. Visit alkaliservices.com to contact us and take the next step to a bigger and better future.
My name is Leanna Dunlap, and I am President and CEO of CoreSpace, and I was really hoping for a battle of wits with Bob and Steven, but it was clear they were totally unarmed.
Welcome back to the next level. Dr. Nelson, we're here with Dr. Nelson Simmons, founder and CEO of Personal MD. If you want to learn more, please visit personalmd.net.
So just before we went to commercial, you asked you teased with a very deep issue, which is Apple a day and whether or not that makes a huge difference. So where were you going with that?
Where I was going is what is your biggest pet peeve? Because it's a leading question because I think it's something we both share.
Yeah, my biggest pet peeve is that the public doesn't exactly understand the cost of healthcare. It's hidden within copays. It's hidden within the insurance model, and technology has driven the demand for us to provide our patients with the best, but ultimately there's a cost that goes with that. And as we, as physicians, try to manage both cost as well as quality of care, it becomes a struggle. And medications that are being advertised on television. Everybody knows someone who's had an MRI. They come in almost demanding that they need an MRI when an X-ray might do. And when we start talking dollars, because most of my patients have to manage their own dollars, they're like, "Oh, okay, well maybe I will do the X-ray." And it's one of the challenges is what I do in my practice is that I'm not afraid to speak about dollars with my clients, and we go through the process of hammering out cost. And sometimes I'll say, look, these are the tests that are most important to me. These can help me, but they're not as important. I show them line item cost for each particular test that we want to do, and then it's up to them to decide how much money they want to spend.
So in your model, real quick, then the office visit is what they get for the subscription. All these extra tests are things that they would then have to pay for, right?
Exactly.
Because you can't have an open book to do every test everybody wants when they walk in the door.
Right,
go
exactly.
broke.
Yeah, and so what we do is we include every test that I own. So, something like a strep test, a flu test, a urine test, an EKG, those type things are included within the model that we provide. But outside tests, lab work, x-rays, MRIs, CT scans, ultrasounds, specialist visits, anything that would be outside of the four walls of my office, there's a charge.
Okay.
And there's such a huge gap in knowledge, right? A lot of times employers, our healthcare costs are going crazy, whatever, but they're usually focused on the cost of insurance. So you talk to most people, they talk about the cost of insurance. But what's one of the drivers of the cost of insurance? It's how do we utilize healthcare? And so one of the services that we'll provide a lot is when people will call and, hey, I got an MRI CT, is this covered? Where they're sending me here, and our service team will help people say, hey, I know they sent you to the hospital to go do that, but there's a freestanding clinic that might be like a tenth of the cost. There's no understanding of the cost, so no one cares, and they just kind of go and do it mindlessly. And so what I really love about what Nelson does, what they do, is they bring to light that cost. And whether you have an insurance program or you don't, like I have insurance, obviously, it's valuable to understand that and understand, to be able to make more informed choices.
Well, and it's also interesting. My son just turned me on to the Joe Rogan Experience podcast, and I listened to an episode with a guy named Peter Schiff, and I really recommend that everybody listen to this because he talks about health insurance a lot and a bunch of other things. But in the health insurance, he kind of draws the analogy of health insurance versus car insurance. Well, in car insurance, you really don't want to ever have to use it, right? Because that means something bad has happened. There's been an accident, but you don't expect your health insurance, your car insurance to pay for your gas and your tires and all this kind of stuff, your oil changes. But when you get to health insurance, people expect it to pay for everything
Yep.
that ever happens to me. You get a hangnail, I want the health insurance to cover it. It's crazy.
Well, and as a primary care physician, the way that we're trained, we can handle 92 out of every 100 problems that walk in my door. So the money that people invest as being members at an office like mine is well spent money, because that's going to cover the majority of their care, and it allows them to choose a healthcare plan that might be structured a little different than they're used to. Maybe a higher deductible, a different structured plan, a cost-sharing plan of some sort. And, that just gives them a chance to get the care they really need, which is services like we provide, colds, allergies, flus, headaches, wellness care, all the more common elements. I won't say easy elements, but the more common elements there. And then we save insurance for those big bad problems.
So once you decided to split from your previous partnership opportunity and you got your wife on board with this new concept, what was the biggest risk or scariest thing that you had to decide to do to make that happen?
Well, there's so many obstacles in starting a company, so many that I wasn't aware of. But as we kind of chipped away and finally got the doors open, I remember telling my one employee at the time, I go, bring a book, because we probably aren't going to see anybody. And what was interesting is we ended up seeing 3 or 4 clients that very first day that we were open. We were pulling stuff out of boxes to see them. We're like, anybody know where the stethoscope is? I think it's in a box somewhere. Let me find it. We weren't exactly as prepared as we thought we would be. But the biggest challenge that I ran across was people don't think about their doctor until they're sick.
Yeah.
And so I had talked to 100+ clients before I decided to leave, saying, hey, if I do this, will you follow me? And everybody said, absolutely, we'll follow you. We'll do that. And I said, here's what I'm planning on charging. What do you think? They're like, no problem. But then when I opened my doors, they weren't there. But that's because they weren't sick. They didn't need a doctor at that moment.
Yeah.
And so it wasn't until they needed a physician that they reached out, and then they would call my old office because they were trying to find me. And
So how'd you get the word out?
it was not easy. I don't know, just time. And I did have some, I was nice to the front staff at my old practice, and they kind of kept my business card there. And when someone asked, they were kind enough to give out my number.
Did you hire anybody for like marketing or PR or what?
I didn't do that in the beginning. And in fact, I did do that, and that was kind of the game changer for me. But it was the biggest risk that I took when I was growing my practice. And what happened was the first kind of couple of years that I was open, I kind of just stumbled and, went to business networking meetings and, went to the Rotary and just tried to meet people and, knock on doors and just introduce the concept of what we were trying to do. And I ended up running across a group out of Boston called Renaissance Healthcare that went across the country and did some research on which type of cash practice worked the best. I decided that their model that they finally decided on would be something that we could apply to the self-employed. And so I decided to do a test market, and I started a little program inside of my office called 40/40, where we would charge $40 a month to be a member, and anytime they came in, they would pay $40. And so we called it 40/40. It was fairly simple, straightforward, and I ended up enrolling 100 people fairly quickly. I followed them for a year, and at the end, I decided that that was the model that was much better than what I was presently doing, which was charging a flat fee for the year. So I talked to my wife, and I said, we got to get this out there. We got to figure out a way. I go, I don't know how to do that. So I ended up hiring a guy named Brian Cummings, who was a public relations guy. And it was risky because I had to pay him more than I was paying myself.
Wow.
It didn't come cheap. But I ended up having several, coffees with them and just some lunch meetings. And he finally came to the conclusion that he would take me on as a client. And the guy hit a home run. The first, public relations thing that he did, he got us on the front page of the Dallas Morning News business section. And that just kind of threw us into another stratosphere.
I think I remember that article.
Yeah, in fact, it grew us so fast that we didn't know what to do. We weren't prepared for the volume of phone calls that we were going to get. And the problem is it wasn't. It's not as easy as it sounds. What you try to write up on a one-page article doesn't always. What you write up on a one-page article doesn't always turn out to be what someone needs. So someone reads something and then they end up trying to apply it to their personal life or their personal healthcare system, and it just isn't the same. So it generated a lot of leads for us, and we ended up being able to convert a large number of those into clients. But ultimately, that was the biggest risk that I took because of the amount of money I had to lay out on the front end, not knowing what the return was going to be. And for me, that was, not the way that I grew a business.
Yeah. Well, having watched and known you as long as I have, you've had a lot of momentum and growth. Just out of curiosity, why have you made the choice to not have multiple, or was that, I know early on, it was kind of a vision?
Yeah, when I first launched the company, I had a saying that I wanted 10 clinics in 10 years. And the idea was that this was a model that could grow. It was, I felt it had potential. It applied to a lot of different people. And we tried to force the issue, and it just wasn't God's timing. And we've continued to pray about it. And every time that we have forced that issue and we've hired somebody or, tried to hire somebody to be an extender or to be a provider with us, God has put a big cooling blanket on that and said it's not the right time. So for us, we operate under what's called a micro DPC, a micro direct primary care office. And, we just continue to, to pray about where he wants us to go with our practice. But, at this time, it's me and my wife, and I have 2 employees, and we have about 2,000 covered lives that we take care of in all different shapes and forms, whether it's a small individual that, is a real estate agent, or I have one company that has 500 employees, and we take care of the entire company. So, we're pretty broad in what we can take care of, but ultimately we're just providing quality health care to people who don't generally have access to it.
So being on the in the newspaper was a big game changer for you with getting clients. What else have you used more recently that has been successful getting the word out?
Yeah. Well, that newspaper article led to Fox 4 News coming out and doing a piece on us, and then that turned, since I'm fluent in Spanish, Telemundo came out and did a piece on us, and then we continue to do. The Associated Press has picked up some of our articles, and we did more press releases on different services and programs that we're offering.
And some things on social media.
Yeah, Facebook has been great. Most of that is driven by our clients. But we had one of our clients that went on a group called McKinney Moms, and she made a positive comment about us, and that ended up generating a lot of clients as the power of Facebook. Every time we have a little questionnaire when people come in for the first time. It says, "Where'd you hear about us?" And all of a sudden it said, "McKinney Moms, McKinney Moms."
Love those McKinney Moms.
And women are the ones who do a lot of the healthcare shopping for their families.
Oh yeah.
And that was just another way that we had not planned on that ended up growing our company.
Well, that's fantastic. Well, Nelson, thanks so much for being with us today. We've really enjoyed talking to you and learning more about your business. For our listeners, please go to the web for personalmd.net.
Yeah, that's right. If you heard something or you know someone that can benefit by listening to today's show, please help spread the word. Have a great week.
See you next week.
You have been listening to The Next Level, Conversations That Propel Business with Stephen Nooner and Bob Gibbons. Join us every Tuesday at 1:30 p.m. for more prolific conversations that will take your business to the next level.